So let's as long as we have identified that the two of you are working. You're part of the oligarchy running Health and Human Services, according to Senator.
He is the oligarchy. I am just a foot soldier.
Okay,
he's part of the garchy.
So
the malarkey.
So let's talk a little bit about what might be coming out of this legislative session in the Health and Human Services area. What kinds of So
Whoa, you want to show him? Because that's what it is right now.
So
Except for one good effort he has on working on the 7%, I don't see a whole lot.
Okay, Senator Abeler, tell us about the 7% and whether or not that blank sheet of paper accurately represents the work of your committee.
Well, there's a couple things. It's not a budget year, and the surplus that people think is so large is actually quite small.
And it's one time.
And it's not. And part of the surplus is inflated by something that happened between the Department of Human Services and the Center for Medicaid Services in Washington, and undid a 7% raise that we gave to the disability service providers. Mm-hmm. And so to buy that back, we spent $53 million in the bill that I got to run, took all our money, and we're still about $28 million short to restore it. Mm-hmm. The House conjured up some money, some was real, some wasn't, but they were able to, in their budget, to try to at least address that. That's only to go back where we were. Mm-hmm. And so in the bill that we passed out, we had $15 million for school-linked mental health grants, a little bit of money for child protection training, and a little bit of work on trying to help Mille Lacs and another tribe, Leech Lake? Leech Lake and Mille Lacs Lake, to take over their child protection, to work on some planning. Mm-hmm. And so very frugal, very tight bill in terms of focusing. And a lot of good policy, trying to improve some of the functioning of how we do our assessments for the disabled. We spend $250 million every 2 years on assessing people to see what they might need for people with disabilities, and have been trying to shift more of that into services. And a few other things, but it's, and unfortunately my good colleague here is not totally incorrect, that it's not a big year for human services, but for the first time in some years we had a positive target, which has been a bipartisan challenge. There's so much money there. People think we're a bank. There's just lagoons of billions of dollars laying around waiting to be siphoned out.
Senator Isaacson, Health and Human Services.
You know, to Jim's credit, one of the things when he asked me to join the committee, which I'm still very appreciative of, it's been a learning experience, it wasn't in my wheelhouse, is that the enormity of the task in front of us is just stunning. It's awe-striking how much we have to do in the multiple areas that we have to do things in with increasingly shrinking revenues. And it puts Jim in a really tough spot, which makes it, not to be glib, but makes it easy for me to take shots, because there's always something he didn't cover that I can then say was really important, right? And it puts the Republicans, and when we are in charge, it puts us in a bad spot, because there just isn't enough. I mean, you think about what you said about the 7%, that keeps us almost at normal, but we're already, even at normal, in a crisis situation with how we're taking care of people with disabilities, and frankly putting ourselves in a real dicey spot, I think, judicially at some point with the lawsuit, because we're just not providing what's necessary to even meet with Olmstead, or to meet with the things we got to accomplish. And the amount of money it would take just to do that alone would be something that his caucus would never be comfortable with. And frankly, when we were in charge, we put a cut score on health care too, on Health and Human Services. And so it's a really dicey situation. And what I'd say is that I don't know about the policy. I spend a lot of my time Googling terms when I'm in this committee because I'm learning so fast. But I feel like there is some areas that due to the politics of his caucus, we can't go to that I wish we would.